We're here outside of Kelowna General Hospital, and we are 5 weeks in, or at the beginning of the 5th week of what is supposed to be a 6-week pediatric service interruption. This morning, the Minister of Health, who has not bothered to show up in Kelowna to talk to doctors or talk to people, started backsliding and watering down that 6-week timeline. So now we actually have no timeline for when pediatric services might be available again at KGH. We've seen numerous stories coming out around patients having to be transferred, including most recently a 3-year-old with a broken arm who took almost 40 hours to get into surgery because there is not pediatric service available here. So we are in the middle of a crisis. We are in the middle of a collapse of our healthcare system, and we have a Minister of Health who continues to fail to show up. It is ridiculously irresponsible that this far in to a crisis, Minister of Health Josie Osborne has not yet showed up once. She has never set foot in Kelowna General Hospital. She has not talked to doctors. She has not talked to nurses. She has not talked to patients, and she continues to avoid showing up. So we are once again calling on Minister Josie Osborne to show up, come to Kelowna, talk to doctors, talk to patients, get an understanding of the crisis that is unfolding on the ground here, and start delivering solutions. People in Kelowna, workers in Kelowna General Hospital are frustrated, they are tired, they are done with the spin, they are done with the delay, they are done with the uncertainty. It is time for Josie Osborne to show up, hear from the people, and start actually delivering solutions. I'm now going to turn it over to my colleague Kristina Loewen. You want to go in the middle, Kristina?
Yeah, thank you. Kelowna is in crisis. Doctors and nurses have been sounding the alarm for at least 5 to 10 years, and yet upper management has refused to listen and implement steps that would help. We have 20 pediatricians in this town, and only 5 are working at the hospital. Because of this weekend, a 3-year-old with a broken arm and a dislocated elbow had to be sent to BC Children's, spending hours in agony. That's just unacceptable, and it's heartbreaking. We have to ask ourselves, why is this the case? We're calling for immediate action and to stabilize and support our healthcare system. As a mother and as a woman and as a patient advocate, I'm advocating for the birthing women in our community in Kelowna. OBGYNs have sounded the alarm. In Kelowna, there's been a wait list for midwifery care as long as I've lived here, which is almost 3 decades. Minister Dix acknowledged the value of midwives in his May 2024 newsletter honoring the Day of the Midwife, and yet today we have at least 2 midwives that I know personally not working in this community. The demand is there, the need is real, and the silence is deafening. Let's build an environment where healthcare workers want to stay. Let's offer leadership, not lip service. We need our health minister here now. Let's make Kelowna a place where families can grow and providers can thrive.
Macklin?
And I'll turn it over to Macklin, sorry.
Great. Thank you, and good afternoon, everyone. Kelowna and the central Okanagan are some of the fastest growing regions in the province. But while our community has grown, our healthcare system has stood still. Pediatric wards are being shut down, emergency rooms are overflowing, patients are being treated in hallways, and this isn't a surprise crisis. Doctors, mayors, and families have been sounding the alarm for years. The BC NDP government knew, and they did nothing. This is not just a service failure, it's a breach of public trust. British Columbians deserve better than hallway medicine and government deflection. They deserve accountability. They deserve healthcare that keeps pace with population growth. And they deserve a system that includes, not ignores, frontline workers. This isn't about finger pointing, it's about standing up for the people who are being let down by a broken system. We need real reform, not spin. Real transparency, not more silence. Thank you for coming, and we will open the floor for some questions now.
So when you say you need immediate action, what is that?
You just step into the center.
Yeah, you bet.
Can you direct questions to certain people, maybe?
Yeah, certainly can. Why don't we just let this lady pass
Sure.
through here first? Sorry, man, you're not on camera. Do you want me to go back?
Go ahead. Sure.
Okay. What was that again?
When you're calling for immediate action, what does that look like?
Step one is rebuilding confidence in the system. There's a lot of tactical action that needs to be taken here, but the reality is a plan in the absence of buy-in from the people relied on to execute it will not work. God himself could lay down the perfect plan on stone tablets and hand it to the CEO of Interior Health today, and it would not get implemented because there is no trust in this system. There is no communication in this system. There is a broken relationship with the frontline people who are being relied upon to implement care in Kelowna General Hospital. So step one has to be rebuilding confidence with the people that work in the system. That is why Josie Osborne needs to show up. It is embarrassing that this far into her term as health minister, Minister Josie Osborne has not ever set foot in Kelowna General Hospital. She does not know what is happening here. She is not talking and listening to frontline people here. They do not have confidence in the current leadership of Interior Health, and she continues to avoid showing up. We have invited Minister Josie Osborne to come to a town hall on July 2nd and to hear direct and unfiltered from the public and from people. She should be meeting with doctors direct and unfiltered, and she continues to refuse to do so.
So you get more access to her than we do. When you've asked her, what does she say?
Over and over again, all that we hear from the health minister is we're working on it. We hear the same deflections, we hear the same delay, we hear the same non-answers. This morning, in an interview on CBC Radio, the minister was asked whether she would come to Kelowna. She avoided the question. She has been asked repeatedly whether she has confidence in the leadership of Interior Health, and she goes out of her way to avoid actually answering the question of whether she has confidence in leadership. She says she supports leadership, she will offer support, she will not say she has confidence. And again, this morning, in that interview on the CBC, the Minister of Health walked back the 6-week timeline for reopening pediatrics, provided an unclear answer that should give nobody any confidence in when this will actually reopen. I've said it before and I'll say it again. The closure of pediatrics is a major issue. The uncertainty is even more challenging for families, both that live here and that are coming here in the summer for tourism. They have no certainty that there's going to be pediatric care if they need it. People have lost confidence in the system. That confidence needs to be rebuilt. That needs to start with leadership, and Josie Osborne needs to show up here.
Gavin, when we asked the minister last week whether she would come to Kelowna, her words were, when the time is right. What's your response to that, when the time is right?
The minister says she'll come here when the time is right. The right time was yesterday, minister. Show up. Listen to the doctors. Listen to the people. The right time is now. Stop with the delay. Stop with the spin. Stop with the canned radio interviews. Stop with the non-answers. Show up and listen to the people now.
I want to ask you, between the three of you, how many messages, whether it's calls, emails, as far as feedback goes from concerned citizens, families, how are you doing with that? How much of this are you dealing with it? And how many messages are you getting?
I can go. Yeah, we're getting a ton. Facebook Messenger lights up, Instagram lights up. Certainly our MLA office emails are all lighting up as well. It's constant. It's the number one issue for right now in Kelowna, absolutely.
You spoke with the father of the child who broke his arm. When most recently did you speak with him, and have you heard an update?
We emailed back and forth over the weekend, and the last update I heard was that it was almost 40 hours until they were able to get surgery.
And now, do you know anything about how they're doing?
I haven't received a new update.
What should be done? What would you do then? If the BC Conservatives were in power, what would you do to fix this crisis?
I've said this before and I'll say it again. The starting point is rebuilding confidence in the system. That has to start with change from the top. We know there are a lot of tactical moves that need to be made in order to stabilize the system, but the first thing that has to happen is rebuilding trust and confidence with the people that work in the system. That starts with leadership. The Minister of Health should already have showed up at Kelowna General Hospital. She should already have met with doctors. She should already be talking to people in order to get a first-hand understanding of what is happening, what is working, and what is not working. And it is shameful that the Minister of Health continues to neglect her basic responsibility of showing up here, understanding the problem on the ground, and taking action. Before any tactical actions are really going to work, it starts with trust. It also starts with moving away from this meat grinder approach where we're going to go find new people to work in this system until they're burned out and leave. We have to actually focus on retention. We have to get people who have left the system, who are here in Kelowna, who would work in a functional version of the system, back into working at KGH, and that starts with a reset and a rebuild of trust.
We are in week 5. We're entering week 5 of the pediatric ward closure. What does that tell you as far as any kind of a timeline of it reopening? Do you see it reopening? We're not hearing any concrete timeline information.
The lack of a concrete timeline for reopening pediatrics is very concerning because, again, this is a health authority, this is a minister, this is a government that do not seem to have a grip on this situation. They're telling us that they're talking to doctors. We see no evidence of progress. They're telling us that they're out advertising to hire doctors in the United States. That's great, but there are 20 pediatricians here in Kelowna who have declined to work in the hospital system. And when we've talked to people in the health authority, they've told us they don't even really seem to be interested in talking to these people. In fact, they never even did exit interviews with these people when they left the system. So that's why there has to be a reset, there has to be a rebuild, there has to be a change in attitude that actually respects people that are working in the system, that listens to them when they flag issues and offers solutions. Solving this problem, stabilizing Kelowna General Hospital, rebuilding confidence in interior health starts with leadership, it starts with communication, it starts with trust, and it fundamentally starts with recognizing that the people that work in our healthcare system are the main part of the solution.
So the only information that we're hearing as far as any kind of a timeline is at last word that towards the exact wording was building towards reopening. We have a pediatrician starting this summer and 2 more in September. What's your takeaway from that comment, that statement?
It's pretty vague. So we keep being told that there's more coming, that there's people coming, that we're working on this, that we're recruiting, that we're, doing all these things, and yet it's vague. And like you heard this morning, there was a walk back on that July 4th date of reopening. There's no guarantee at this point. So it's another knock at public trust and frontline workers' trust.
Why did you choose to have this news event outside of the hospital today?
Well, I think it's important for people to see their own hospital in the background. We're here, boots on the ground. All 3 of us are home in Kelowna and West Kelowna, and we have been for the past 4 weeks. We've been doing a lot of work on the ground, meeting with those emails that I referred to earlier, meeting with parents, meeting with midwives, doctors, nurses, and engaging with our community, which is, and sort of the repeated story and the frustration is that the current NDP government and the current ministers of health and current health authorities have not been doing that. That's the frustrating thing.
What's the purpose of the town hall that you are organizing? All 3 of you are hosting it. That's your event. What do you hope to accomplish with it?
The purpose of our town hall next week is to give people the opportunity to tell their stories, to share their stories, to share their ideas and their solutions. And frankly, we want to draw attention to just how big an issue this is for our community. We have invited Josie Osborne, the Minister of Health, to show up at this town hall and to hear from the people, and she has refused, she has declined, she has not set foot in Kelowna General Hospital. We're here today outside the hospital doing exactly what the Minister of Health should be doing, and that is showing up, answering questions, hearing from people, and trying to offer solutions. Throughout this entire experience, we're not just trying to beat up on the government, we're pointing to the solutions that need to be brought forward. And the first part of that is rebuilding confidence in the system with the very people that work in it. So it is so profoundly disappointing that the Minister of Health will not show up and answer questions like we're doing here today.
Sorry, one last thing, and then I don't mean to monopolize, but just as you're speaking, Gavin, I just received a message from the ministry asking me if I can share with them specifically what groups of doctors are asking for the minister to talk to them. Are you hearing from doctors directly? They're asking me basically what doctors want a visit from the minister.
That is absolutely shameful, Claudia. It is, wow. So as we are standing here today, the Ministry of Health is emailing a journalist asking her to name names, asking her to name the doctors that want the minister to show up and hear from them. This is in an environment where over and over and over again, we have heard from doctors, we have heard from other frontline workers who fear retribution if they speak out. There is a culture of fear. There is a toxic culture. There is a culture where people who work in the system are afraid of raising their voices. They have thanked us for amplifying their words, even if they can't put their names beneath them. It is so incredibly shameful and hurtful and frankly disgusting that we now have communications people in the Ministry of Health trying to get journalists to name the names of doctors who have spoken up. This is absolutely shameful. The Minister of Health should show up here. She should make herself available. She should meet with doctors and other frontline workers without interior health staff in the room, and she should actually hear from them. She should not be engaged in a witch hunt designed to identify which doctors, which nurses, which frontline workers are speaking up at the failure of her system. I could not be angrier at this situation. This is absolutely ridiculous and absurd for the ministry to be more focused on hunting down the doctors who are speaking up than on actually rebuilding confidence and trust with them.
So the wording is what group of doctors? I don't know if that changes your answer.
But there has been, doctors have said that there's acrimony building because it's becoming a political issue rather than a pragmatic issue. What would you say to that?
It takes a lot for doctors to start writing open letters to the public through the media and to start calling their MLAs. These are highly trained, frontline healthcare professionals who have worked in this system for years and who will work in this system for years. This is not just some folks beaking off. This is highly skilled individuals who have clearly given up on the effectiveness of the formal channels for raising their issues within their workplace. The fact that doctors are speaking up in the way that they are doing now, publicly, through us as their MLAs, tells you just how bad this situation is, just how little confidence they have in the system, and just how big a breakdown in communication and trust there has been with the corporate leadership of Interior Health.
I just add something to that as well, that I don't believe this is political at all, quite frankly. A lot of the questions we've talked about here, we're saying, the minister, the doctors, and there's also the public. There's young children that might need to come in for emergency treatment. It's a major hospital across the province. I myself, in my riding in West Kelowna, I've had people from across the valley that have called me and said what's happening. They're worried because this is their secondary or tertiary hospital to cover other hospitals. I'm hearing a lot from the minister's office and from the NDP government that, this is just a political thing. It's not at all. A lot of the stuff that we ran on during the campaign and everything, not just healthcare, a few other things. Everyone needs to see a doctor. You might need an emergency room today. Any of us here might need to come here today. That's not about politics. If the service is not being provided and the minister wants to go after doctors, who wants to meet? What are the groups? It's all political. Well, this is precisely our point. You've got groups in this very building right now, doctors, nurses, the staff that make this run, everybody that's involved here in the hospital itself saying there's an issue. We have communications problems. We've outlined the issues here today. And the response from the ministry is just, it's political. So, but does that mean they don't want to talk about it? And if they want to make it, it's a political issue. It's just conservatives, trying to be important. Well, we're working for our constituents. We're working for the public, and I think perhaps the NDP government are losing that view that it's about the people. It's not about us. It's not about party lines. It's about if we don't look at the KGH for a second, this entire community, my riding, the three ridings in Kelowna, the whole Okanagan Valley. I've even had conversations with people that tell me this hospital will take people from as far as away as, the East Kootenays. I mean, this is a major hospital for British Columbia. So I don't think it's political at all.
A question that is a little political. Gavin, we're hearing that there was a BC Conservative failed fundraiser and now a caucus meeting this week. This amidst the three MLAs that left and allegations of blackmail. Do you have confidence in Jen Rostad and would you like to seek the leadership if not?
I think those kinds of questions are a distraction from the matter at hand here. Right now, what I'm focused on and what my colleagues are focused on.
We are here, and we would like to ask you this because we've exhausted the questions on the healthcare situation, and this is something that's happening this week with your party.
I'll be honest, I've spent the last 3 weeks entirely focused on this issue with Interior Health.
So do you have confidence in your leader?
I think that Right now, I think we all have confidence in John Rustad. We all have confidence in leadership. We all want to make sure that our party is set up for success, and we all want to make sure that we're focused on the task at hand. For the three of us, what we've been doing over the last number of weeks is frankly hammering the heck out of the government on their total failure in our healthcare system. That's what we need to do in order for our party to be successful, for us to build ourselves and show ourselves as a government in waiting is to continue to prosecute these kinds of issues that matter to people here in our ridings, here in our region on a day-to-day basis.
And I'll ask the other two of you if you have confidence in your leader at this time going into a caucus meeting.
I absolutely do, and I agree with Gavin, this is a big distraction. And as to your question about the caucus meeting, it was planned from months ago, and we have one about every 2 weeks in the summer.
I agree with what my colleagues here have said. You know, I've just been, ever since I got back from Victoria, nose to the grindstone, working hard. This blew up really quickly. It's taken a lot of my time. I know they've been very busy and active with this. And then there's everything else in my riding and in the region as well. So I have total confidence in my party and my leader and my colleagues. I mean, and we're going to continue to work hard. And that's, you know.
Is it discouraging that the conversation keeps going in that direction, though?
I'm not hearing much of it, to be quite honest. I've been so busy and consumed with the KGH crisis and other things going on in the constituency that it's been really, I was actually surprised to hear the questions today. So
I think what you see here today is an example of exactly what is working in our party. We have 3 MLAs in the region. We've been working together very closely on this issue. We're doing our utmost to make sure we're drawing attention to an issue that is front and center for everyday people in Kelowna, in West Kelowna, in the entire region, every single day. That's what I think you're getting from our party. We've been hammering the heck out of this issue. We've been talking about the sellout on BC ferries. We've been talking about all the ways in which this government is failing. And the reality is, if anyone's going to talk about leadership, go ask David Eby whether he has the confidence of his party, because Ravi Kahlon is organizing to take him out. David Eby is at war with the base of his party. He has lost their trust and confidence over Bill 7, Bill 14, Bill 15, BC ferries. David Eby will not lead the NDP into the next election. I doubt it'll be a year before he's gone as leader of the NDP. So if the media want to talk about who has confidence in what leader, they should be asking the NDP caucus whether they have confidence in David Eby, because his time is limited.
You mentioned Ravi Kahlon. What was that again?
The rumor mill has Ravi Kahlon organizing to take out David Eby and become the next leader of the BC NDP. So you know what? Maybe somebody should go and ask Ravi Kahlon when he's taking over as leader of the NDP, because it's clear that David Eby is in the beginning of the end of his premiership. This total and absolute failure and collapse in interior health, the lack of leadership, the lack of accountability, the lack of leadership by members of his cabinet, the lack of accountability within his cabinet when Josie Osborne refuses to show up here, shows you exactly what a weak leader David Eby is. It shows you exactly what kind of leadership he's bringing to his caucus, and it is zero. It shows you exactly what kind of focus he has on the issues that matter every day to British Columbians, and it is none. David Eby will not lead the NDP into the next election. The NDP is in an internal crisis. They are in an internal war. They are at war with their base. And mark my words, David Eby will not lead the government into the next election.
Speaking of collaboration between MLAs, what kind of collaboration have you guys had with the MLAs representing Vernon, Kamloops, Penticton? Because all of those hospitals have been refusing pediatric transfer patients. So how are you working with them to really bolster up and elevate your voices?
Yeah, we're in very active conversation with all of our colleagues in our caucus in all those areas. We're hearing from them regularly. The frustration with interior health is much bigger than just the Kelowna area. We just heard about the lab closure in Trail. We've heard numerous other stories related behind the scenes and publicly around other failures, not only within the interior health system, but we're also talking to our colleagues all around the province who are having similar issues with the collapse of healthcare across the province.